Good morning, and thank you for joining today's Knock Out Opioid Abuse webinar. All participants are muted. If you have a question, please use the chat feature. We will address all questions at the end of the presentation. To get us started, I would like to introduce the Partnership for Drug-Free New Jersey's Director of Opioid Response and Prevention Outreach, Angela Conover. Angela.
Thank you, Greg. Good morning, everyone. Thank you for joining us on this rainy New Jersey day. And thank you for joining us for this really important conversation and this webinar, Childhood Trauma, what we're seeing, what we can do to prevent substance use and abuse. Today's webinar is brought to you by the Partnership for Drug-Free New Jersey and the Horizon Foundation for New Jersey. This webinar is being held in collaboration with NJ Cares and the Office of the New Jersey Attorney General, and we thank them for their partnership, support, and collaboration on today's learning activity. Horizon Blue Cross Blue Shield of New Jersey, through its philanthropic arm, the Horizon Foundation for New Jersey, has been collaborating with PDFNJ on a 2-year Knock Out Opioid Abuse initiative to address the opiate epidemic in our state. In light of the current pandemic, we've expanded the offerings to include this webinar series to help continue the conversation about the opioid crisis as we all navigate through this very difficult time. This webinar is the 5th event in a series of collaboration with the New Jersey Office of the Attorney General and NJ Cares, addressing the addiction crisis in our state and how it's been impacted by the COVID-19 pandemic and other issues. To deliver some opening remarks on behalf of Horizon Blue Cross Blue Shield of New Jersey and on the issue we are discussing today, I'd like to welcome Dr. Vivek Bison, Senior Medical Director of Behavioral Health for Horizon Blue Cross Blue Shield of New Jersey. Good morning, Dr. Bison.
Good morning, Angela. Thank you. Just to reiterate, I'm Dr. Vivek Bison, board certified psychiatrist, Senior Medical Director here at Horizon Blue Cross Blue Shield of New Jersey. It's my honor to join you this morning. I would like to thank all of you for your interest and attendance today. I know that this is a very challenging time for everyone, and we greatly appreciate your dedication to continuing the discussion on how we can knock out opioid misuse in New Jersey, especially during this critical time. As many of you are aware, due to COVID-19, the Partnership for Drug-Free New Jersey has had to cancel in-person town halls. The Horizon Foundation has been working with the partnership to develop ways to continue the conversation and community engagement through social media and through the partnership's website. Today's event is the 9th in the Knock Out Opioid Abuse series, which has focused on various aspects of the opioid crisis since the onset of COVID-19 pandemic. There's a recent article in the Wall Street Journal a few months ago that talked about significant increase of opioid use and misuse during COVID-19. In particular, the topic of childhood trauma and substance abuse continues to be of interest to Horizon. Horizon, through its clinical leadership team and community relationships, has focused on trauma and the role it plays on addiction. Chris Barton, who's the director of our Integrated Services of Care and Network Innovation, has put together a panel series on trauma, where she brought together leading providers in the state, policymakers, and us as the payer to provide a more holistic approach to treating substance abuse, and specifically identifying the role that trauma plays in onset and worsening of substance abuse. Terry Jan, who's VP of Pharmacy, has worked closely with the behavioral health team, and her team has gone out and educated students about opioids. As Horizon looks to grow its behavioral health network, one of the first questions we often ask is, how are you addressing trauma, childhood trauma? How are you incorporating trauma-informed care into your substance use, in addition to the pharmacological treatment and the psychosocial treatment that is there? In addition, Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, is extremely proud of our collaboration with the Partnership for Drug-Free New Jersey to bring you today's webinar to Knock Out Opioid Abuse Initiative. The initiative is part of our company-wide response to address and help end this public health crisis. Our state and represents a large portion of the foundation's $1.8 million we have invested to provide support for opioid prevention and education programs to help families and our members. In closing, I would like to thank Special Agent Jack Kim, Dr. Fletcher, and Deputy Attorney General Quigley for presenting today. I would also like to give a special thanks to New Jersey Cares for collaborating with us on this webinar, and to the Partnership for Drug-Free New Jersey team for putting this important webinar together. Together, we can make a positive difference in combating this epidemic. Thank you.
Thank you, Dr. Bison. Thanks for your comments on the issue and for the support of Horizon Cross Blue Shield of New Jersey and the Horizon Foundation in continuing to address the opioid and addiction crisis in our state.
Great, my pleasure.
So as Dr. Bison mentioned, we have a varied and expert panel of featured speakers for today's webinar. And I'm so pleased to introduce them. We have Dr. Beth Fletcher, who is the Associate Professor of Pediatrics and Medicine at Rutgers University Medical School. We have Special Agent in charge of DEA New Jersey, Christopher Yackham, who is also the commander of the High Intensity Drug Trafficking Area for New York and New Jersey, HIDTA. And we have Deputy Attorney General Sarah M. Quigley, who is acting counsel to the Director of Division of Criminal Justice in the Department of Law and Public Safety. So I welcome all of you. I thank you and look forward to your comments. Dr. Fletcher, I will turn things over to you now to begin.
Hello. I'm waiting for my slides. There we go. I'm very pleased to have this opportunity today to share with you some research on childhood adversity that has the potential to tremendously impact healthcare delivery in the next 2 decades and beyond. Since learning about adverse childhood experiences, or ACEs, more than 5 years ago, it has been my mission to share these discoveries with just about anyone I speak to, and my husband can attest to that. Next slide, please. In the next 10 minutes or so, I hope to show you why ACEs are critical to future health outcomes, and you will walk away with an understanding about both the physical and mental health consequences of childhood adversity, as well as how resilience can mitigate some of the potential negative outcomes. Lastly, to see how a trauma-informed approach can be employed in a variety of settings to improve health care, promote effective communication, and even diffuse escalating emotions. Next slide, please. While there are many definitions of ACEs, this one is my favorite. Simply put, adverse childhood experiences are potentially traumatic events that can have negative, lasting effects on health and well-being. These experiences range from physical, emotional, or sexual abuse to parental divorce or the incarceration of a parent or guardian. Next slide, please. Although the initial truly consequential study published by Dr. Felitti out of Kaiser HMO in California and Dr. Anda from the CDC was published more than 20 years ago, it has not been until very recently that physicians, social workers, educators, legislators, and law enforcement have begun to take notice. This initial study was a simple 7-question survey sent to over 13,000 health plan members whose medical records were available for review. Not the most diverse study population, to be sure, with the majority of plan members being white, college-educated, and well-employed, but it was a start. Respondents were asked during the first 18 years of their lives if they were exposed to any of these 7 things: psychological, physical, or sexual abuse, a parent struggling with substance use disorder or mental illness, or witnessing domestic violence in the home, or having a parent in trouble with the law. Next slide, please. The respondents' medical records were then reviewed looking for potential health risk factors, including morbid obesity, physical inactivity, depression, suicide attempt, smoking, alcoholism, drug abuse, and risky sexual behaviors. They then examined specific significant health conditions, including heart disease, cancer, stroke, chronic bronchitis, COPD, diabetes, hepatitis, or skeletal fractures. The data was frankly mind-blowing. Next slide, please. Individuals received 1 point for each of the 7 risk factors they said yes to, and more than half had at least 1 point. 1 in 4 respondents had 2 or more points. But those with 4 or more points on the adversity scale had the most significant and consistent health risks. Compared to those with 0 points, individuals scoring 4 or more had a 4 to 12-fold increased risk to struggle with alcoholism, drug abuse, depression, or having attempted suicide. Next slide, please. Here in graphic form are the study results with percentages from left to right for individuals who had a score of 0 to incrementally higher scores. Each health outcome and risk trajectory trended upward for alcoholism and liver disease, which are likely related, as well as chronic depression and use of antidepressants. Compared to their male counterparts, women were potentially even more susceptible to the impact of ACEs in terms of risk for depression, as you can see in the lower left corner. Next slide, please. These upward trends continued for suicide attempts and even the likelihood of being a rape victim as an adult. ACEs also appeared to be associated with increasing likelihood of perpetrating domestic violence, with men somewhat more likely than women to be perpetrators. Increasing ACEs were also associated with early sexual initiation, teen pregnancy, and teen paternity. Next slide, please. The upward trend continued for smoking as an adult and chances for COPD or emphysema. When researchers looked at these adults' ability to function within the workplace, we can see that rising ACE scores were also associated with greater absenteeism at work, as well as financial difficulties and problems with job performance. Next slide, please. In the 20 years since the first seminal study was published, we have worked to expand and refine the ACEs parameters. 3 more household exposures were added to the 7 initial ACEs, with emotional and physical neglect, as well as parental separation or divorce being added for a total of 10. ACEs cross all cultures and demographics, but may in fact differentially impact children in underserved communities and may contribute to social determinants of health. In this more recent survey from the CDC, 37% of people reported 2 or more ACEs. Next slide, please. As we look to environmental stresses and adversity, especially now as we are experiencing COVID, we have now added 5 more ACEs, looking at community trauma and exposures outside of the home. These things include witnessing domestic violence in the community, or witnessing violence in the community, experiencing discrimination, feeling unsafe in your neighborhood, being bullied, or being in foster care, all of which could certainly be traumatizing. Next slide, please. So here is your chance to do your own very private ACE survey. So looking at your own experiences in the first 18 years of your life and these 7 initial items that Dr. Felitti published, think about how you score on the ACE scale. Many of us have at least 1 or 2 of these exposures. On a good day, I will tell you that I score a 2. Next slide, please. So where does that leave us? The truth is that ACEs can affect anyone, but may disproportionately impact children living in poverty. The health consequences are absolutely not merely the result of making poor lifestyle decisions, but are the result of developmental changes in the growing brain and nervous system. Physicians need to take this on as a healthcare challenge, while communities need to come together to find creative ways to intervene to break the cycle and mitigate the effects of ACEs on children and adults. Next slide, please. One of the ways that we can respond to ACEs and the impact of trauma is to engage in a trauma-informed approach to care and services. As a physician, I need to ensure that every person in my office is educated about trauma-informed care, or TIC, from our housekeepers to receptionists to medical assistants to social workers to nurses and to physicians. However, this is not only useful in the healthcare setting, but can and should be applied to service provision in any community setting. Listed here are the steps we feel are important to facilitating TIC. Next slide, please. So how do people do better than others after experiencing adversity in childhood? The answers may lie to some extent in a person's innate resilience, as well as external factors that may have buffered them from some of the negative consequences. So if we take a look at our own personal experiences, we did the ACE survey previously, let's look at these 6 potential mitigating factors in your life. As you read each of these to yourself, let's find your own resiliency score. Fortunately for me, and likely many of you, we are also blessed to have some of these positive childhood experiences. Next slide, please. As we encounter individuals who survived childhood trauma, we are looking for tools to help them move forward and to work toward healthy goals. I found this resilience survey tool from Devereaux very compelling because it allows for a person to have middle ground, a sometimes, not a definite yes or a no. And in fact, instead of no in the last column, you see not yet. This allows for the possibility of positive change. By identifying a person's strengths and positive qualities, it lays a foundation for personal growth and improvement. Next slide, please. Finally, how do we, as providers, co-workers, friends, or even family members handle tough discussions if someone opens up to us about a traumatizing event? We need to be flexible and normalize the experience as much as possible. By establishing trust through active listening and acceptance, while at the same time acknowledging and affirming the individual's feelings, the healing process for the victim can begin. Next slide, please. Thank you very much for your time and attention. Next, you'll be hearing about a new and innovative statewide program called Handle with Care.
Thank you so much, Dr. Pletcher. That was really eye-opening information, and appreciate you being with us this morning to share it. I have noticed, and there's been a lot of questions on the chat feature about whether a copy of Dr. Pletcher's slides will be available for you to use. A copy of the slides from today, as well as a recording of today's webinar, will be available. You'll receive an email later this afternoon with information on how to get that information. You'll either receive the email this afternoon or early tomorrow morning, and that information will be available on the website, knockoutopioidabuse.drugfreenj.org. It is now my pleasure to welcome Chris Yacob, Assistant Special Agent with DEA New Jersey. Assistant Special Agent in Charge from DEA New Jersey. I know Chris has put his heart and soul into this Handle with Care initiative, and so pleased, Chris, that we're able to share it today, and thank you for your leadership on this issue. Turning it over to you now.
Great. Thank you, Angela. Good morning, everyone. It's a pleasure to be here. Thank you to Horizon, Blue Cross and Blue Shield for all their efforts as well. I would also like to acknowledge Chief Chris Lusner, who is a police chief down in Middle Township down in Cape May County, as well as the Attorney General's office for all their efforts in this initiative and in this space to address childhood trauma throughout the state. Next slide, please. So the DEA really looks at this Handle with Care program in conjunction with the New York, New Jersey HIDA and the resources and support that we have through that program as a prevention program. And I really like this metaphor of being upstream. And there's a fantastic book by Dan Heath that's called Upstream. I'd just like to read one little story, a short story at it. It kind of depicts the metaphor that we're talking about. So it goes as this. You and a friend are having a picnic by the side of a river. Suddenly you hear a shout from the direction of the water. A child is drowning. Without thinking, you both dive in, grab the child, and swim to shore. Before you can recover, you hear another child cry for help. You and your friend jump back in the river and rescue her as well. Then another struggling child drifts into sight. and another and another. The two of you can barely keep up. Suddenly your friend, wading out of the water, seeming to leave you alone. Where are you going, you demand. Your friend answers, I'm going upstream to tackle the guy who's throwing all these kids in the water. Oftentimes, we find ourselves downstream with a lot of our endeavors, whatever expertise or profession that we're in. It's much more reactive. It's tangible. Sometimes it's easier to see, and it's always much easier to measure. An example of this would be with the current drug epidemic from a law enforcement perspective. You know, we're often looked at upon how much we seize, how much we arrest. EMS and law enforcement, how many Narcans administrations have we delivered and how many lives have we saved? In treatment, we often look at how many referrals and how many people are actually receiving that treatment. Whereas upstream becomes much more ambiguous. Oftentimes, our efforts are hard to measure, hard to determine what impact they have. And especially if you're in the prevention field, it's very difficult to measure that. You often feel like you accomplished something, but you still never really know who you help. Upstream is really about preventing something before it happens. In DEA, we often go upstream by working in foreign countries, typically source countries in South and Central America. And the purpose of that is to reduce that drug supply before it gets to the United States. Well, we've invested a lot of time and a lot of effort in this program here in New Jersey called Handle with Care. And it's about going upstream, and that attempt is to cut off demand. As we often know, often people who are suffering from trauma often resort to drugs and alcohol to cope or mask that emotional or psychological pain that they're suffering with. Next slide, please. So the goal, what are we working on and what is the purpose of this? And that is really to mitigate these negative effects that children may experience from trauma, as well as increasing the knowledge and awareness. Oftentimes, we're asking law enforcement and educators to be involved in this program, and they really have no awareness as to what ACEs is and the impact of trauma. Another result of the program is to build and reinforce these relationships between law enforcement and educators. So what we did here in New Jersey, we adopted a program that was really pioneered down in West Virginia. The Mary C. Snow Westside Elementary School began this program in 2013, and we adopted it and brought it to New Jersey in 2017. Very preliminary initial plans were started and efforts started in 2016, and we're proud to implement it first in the city of Newark here in New Jersey. The purpose is really to address that trauma and those negative consequences. Next slide, please. So as Dr. Fletcher spoke about what are ACEs and how the impact that they have, this is just a brief graphic to give some of those examples. And I'd like to talk about how we started another program here in New Jersey with the assistance in DEA and New York, New Jersey Hyde in conjunction with the Department of Health. And they're called Overdose Fatality Review Teams. And what those teams do is, in essence, do a social autopsy of those who succumb to a drug overdose. And we bring the best and the greatest minds from a county level around a table. And what we do is review what the consequences were, how we, as all these agencies, may have touched that individual's life. Consistently, out of all those reviews, childhood trauma and trauma throughout life is in 99% of those cases that we review. So by understanding this trauma from a law enforcement and an education perspective, we're able to change that paradigm shift in how we think. It's not what's wrong, but what happened to that child. Next slide, please. So what is the program and how does it work? So when law enforcement encounters a child who they perceive was exposed to a traumatic event, they may go to that scene, and that example could be a whole host of different incidences: a drug overdose, an arrest of a parent, a house fire, a child witnessing their dog getting hit by a car. All of these are processed differently, and what's traumatic to one may not be traumatic to another. But that law enforcement officer is going to be more keen to look at those incidents and see the impact that it has on the child. And what the officer will do is obtain three things: the name, age, and the school. Next slide, please. This is just a typical example of a form and what it looks like. The idea is that no details, nothing personal is revealed to the school. The concept is that this form will be then forwarded to the school. Next slide, please. So that when that child arrives to school the next day, the school has some awareness. Typically, if Johnny were to come to school and the night before he witnessed his father get arrested for whatever reason, he would arrive to school the next day and the school would have no awareness. So if Johnny is not in a good state and he's acting out emotionally or physically, say Johnny gets into a fight, the school has no awareness, and typically there'd be punitive actions taken against Johnny. Johnny, you have detention. I want to see you after school. But yet Johnny's struggling with this and trying to process this trauma that he witnessed the night before. So the idea is that the school has some awareness. The confidentiality piece is maintained, but now the school knows, let's silently monitor Johnny and see if any kind of behavior manifests itself where we may need to interact. And then what the school would do is provide whatever resources they have. And that varies obviously from school to school and district to district throughout the state. But at a minimum, a school nurse, a trusted teacher, if resources are available, a social worker, and other counseling resources would be addressed to Johnny. Next slide, please. So I finished with that. That's a quick overview of the program. I would like to offer to scan the QR code or reference Handle with Care New Jersey, where we put together a video, an educational video that is really a 101 explanation of ACEs and trauma, an explanation of this program and how it's implemented and the value of it and why we should all invest with it. Thank you for your time.
Thanks so much, Chris. And thanks for sharing that resource information. We've also shared in the chat feature a link to the YouTube clip, so you will see that in the chat feature. And once again, a copy of this presentation and a recording will be available for all of you tomorrow on the event website. So now I'm going to welcome Deputy Attorney General Sarah Quigley to share with us her perspective on this issue and the new directive from the Office of the Attorney General.
Thank you so much, Angela, and thank you for having me this morning. Importantly, thank you to everyone for attending today's important webinar, and to Dr. Pletcher and Special Agent Yakum for their presentations as well. I'm going to talk now specifically about Attorney General Directive 2020-9, which implements this Handle with Care program that Special Agent in Charge Yakum was just discussing statewide. So as you heard, programs like this Handle with Care have been implemented in various counties and agencies in New Jersey. You have the DEA in Newark, Middle Township with Chief Lusner in 2018, Cape May County soon thereafter. There were various other counties such as Hunterdon and Ocean that also have CARES programs. And these programs have paid dividends to helping children in these counties. So replicating it statewide would extend the program's reach to children in every town and every county across the state of New Jersey. And that's really the goal here. Next slide. So this Handle with Care directive is about connection and communication between law enforcement and educators. As was explained, there are very serious side effects on children who are exposed to adverse childhood experiences and traumatic events. So the goal of the directive was to mitigate those effects through law enforcement communication to the child's school. As you heard from Special Agent in Charge, Chris Yakum, what generally happens when a child experiences something traumatic is that the child has to continue about their day as if nothing ever happened. They have to go to school, do their homework, perform on exams, basically behave as they normally would. But it's not like any other day, right? Perhaps the child didn't do their homework because of what happened. The child can't focus on the pop quiz that was given the next day. The child is lashing out at other students or the teacher. Well, the teacher doesn't know that the student just witnessed something traumatic. So the teacher might discipline that student, unknowingly compounding the negative effects on the child. And as law enforcement, we want to do what's in our power to stop that potential downward spiral and stop the maybe possible drug use and abuse and the other negative effects that were outlined by Dr. Fletcher. Next slide, please. So this directive gives law enforcement another tool in their tool belt to help children, because law enforcement are the ones who are responding to the traumatic events. They're the ones with the knowledge of what the child witnessed. Now, before this directive, unless the child lived in an area that had some sort of handle with care or CARES program, the child's school had no idea what the student recently experienced and why the student may be acting, behaving, or performing differently. So this directive really opens that line of communication between law enforcement and the school to handle that child with care. Next slide, please. So let's just go through some of the definitions to better understand the directive as we move forward. A child, you'd think in the normal sense, is an individual under the age of 18. However, in this directive, we talk about a child meaning a student of any age who's enrolled in a school, whether that school is public or private, and in pre-K through 12th grade. So for example, if the student is 24 years old and in 12th grade, this applies to that student. Now, point of contact, this is a very important term in this directive. It is the school employee who is receiving these handle with care notices for children that are enrolled in that school. And that identified individual is also importantly responsible for ensuring that the notice gets to the child's teacher or teachers. Now, the point of contact for the school is entirely up to the school. The school may have 2 or 3 individuals, for scheduling purposes. The school may prefer a centralized email address, so several points of contact can obtain the notices. It really depends on the school and the school's resource as to how and who to appoint as the point of contact. And lastly, as you heard about traumatic events, under this directive, there are experiences that could have damaging effects on the child or the ACEs. They should be construed very broadly for purposes of the directive. They can range from witnessing a drug deal in the home, observing domestic violence, or even attempted suicide. One thing to note is that these traumatic events, for purposes of the directive, are ones in which the child is actually present, and the child is a witness or a victim to the traumatic event. So if something happens in the home while the child is perhaps at school or out at a friend's house, and the police respond to the home, that's not considered a traumatic event under the directive because the child is not present, nor is the child a witness or a victim. Next slide, please. So how does the directive implement this Handle with Care program? So it directs all law enforcement agencies to enact or adopt a policy for implementing a Handle with Care program within the guidelines and procedures outlined in the directive, which I will now go through with you. So an officer will respond to a traumatic event and sees that a child is present. The officer, as soon as practicable, will complete what is called the Handle with Care notice, as you saw from Special Agent in Charge Yakum. This notice gets completed whether the child goes to a public or a private school. And if there is more than one child present, the notice should be completed for each child. For example, let's say there are 4 children present in the home. There should be 4 notices, even if the child goes to the same school. Each child may have a different teacher, and as was discussed, each child is unique and may respond differently to traumatic events. Next slide, please. So as you just saw, this is the Handle with Care notice. You can find it at the end of the Attorney General's Directive 2020-9 on the AG's website. This is the only information that should be filled out in connection with the Handle with Care program under the directive. So you have the name of the school, law enforcement agency completing the notice, and the date and time of the incident. Then, of course, the child's information, name, age, and school, and grade. So the officer will sign that at the end. Now, this is the only information that should be included, again, with respect to Handle with Care. There should be no other additional information sent to the school. The details on the incident, including the type, whether there was an arrest, the relationship between the party arrested and the child, that's all information that should not be shared with the school in relation with Handle with Care specifically. That's not the purpose of the notice. Rather, law enforcement in this respect are simply notifying the teacher and the school that this student should be handled with care, regardless of the underlying incident. Next slide, please. Once the handle with care notice is completed, the officer must send it immediately to the child's school. This means prior to the next school day or before the child arrives at school, whichever is sooner. The timing is especially important because the whole point of the program is to give the teacher the proper notice that something traumatic happened to their student, which will help the teacher mitigate any negative effect on the child. The teacher can monitor the student and respond accordingly, perhaps giving the student a pass on missing their homework assignment, give the student a bit more extra help or extra time to complete an assignment, or if appropriate, referring the student to the school counselor. All things that Special Agent in Charge Yakum had spoke of before. So what happens when the child's school of enrollment is outside of the law enforcement agency's area of responsibility, or what we call the AOR? Because the officer may not know the point of contact at a school outside of their AOR, the officer must send the notice immediately to the local law enforcement agency where the child's school is located. And that law enforcement agency will then send the notice immediately to the school's point of contact. For example, let's say an incident occurs at Uncle Joe's house in Trenton. The child is present and law enforcement respond. The child says that he attends Hopewell Valley Central High School. Trenton PD would complete the handle with care notice, send it immediately to Hopewell PD, and Hopewell PD will forward it to the high school's appropriate point of contact. Next slide, please. So we've discussed two procedural scenarios. One, sending the notice to the school of enrollment within the agency's AOR. Two, if the child's school is not within the agency's AOR, then sending the notice to the law enforcement agency where the child's school is located so that the local agency can send the notice to the appropriate point of contact. And now a third scenario, where the school returns the notice to the law enforcement agency because the child is in fact not enrolled in that institution. When that happens, the law enforcement officer should make a good faith effort to identify the correct school of enrollment. This could mean asking the parent, guardian, or other family member if appropriate. Now, it's important to mention that there will be times when a parent, guardian, or other person who's present will not want to disclose where the child goes to school. The last thing we would want is a confrontation or escalation of the situation. So in those cases, the officer must respect that decision and not press or force information from the individual. This is simply about helping the child to the best of law enforcement's ability and not creating hostility or any additional tension. Next slide, please. So with this initiative, there is a record-keeping component. The directive requires that law enforcement agencies keep a copy of the handle with care notice with the investigative file and with the handle with care notice file. So this is where all notices are going to be kept. This record keeping includes transfer notices that went to a different agency. So that was scenario 2 that we had talked about. Both the transferring agency and the agency that ultimately sent the notice to the school are to keep the notices on file. So in my Trenton Hopewell example, both Trenton and Hopewell police departments would keep their handle with care notices on file. And in the third situation, or where the officer is unable to get the information on the child's school, the officer should still fill out the form as best as possible and place it in the investigative file with a copy to the handle with care notice file, so that there does remain some record of there being an incident triggering the handle with care event. Next slide, please. So moving forward, there is a training aspect with this. The directive requires that all officers virtually attend a symposium that we're putting on with DOE in November. This will be recorded so that the officers who are unable to watch will be able to view the symposium prior to the end of the year. Now, although it's not open to the public, educators are encouraged to virtually attend the symposium because there will be a lot of discussion on children who experience ACEs, skills to mitigate cumulative stress and trauma with children, and how it all fits with the Handle with Care program. Communication and partnership. So as we roll this out statewide, communication between law enforcement, DOE, school boards, and private school administrations is really vital to making this program a success. It will be the local agencies in the schools that will determine in their discretion how best and most effectively to implement the Handle with Care program in their district. And as we move forward, we'll have to continuously review the program and determine where the issues are and work to amend it as we go. Various parts of New Jersey have done this countywide, but it's never been done statewide here in New Jersey. So there will be some growing pains and some learning along the way as to best and most effectively provide support for the young people in the state of New Jersey. That completes my presentation. Thank you so much. I'll kick it back to Angela.
Thank you so much, Sarah. That was really detailed, and I think it really addressed a lot of the questions that we have been seeing on the chat feature. So appreciate that. I think you got a lot of information out that people are looking for. We do have some questions for the panel. We're going to get to as many of them as we can before we hit noon. We're doing really good on time. So I'll start right now. Dr. Pletcher, could you address if any of the tools that you referenced are available in other languages?
So I did actually look that up while I was listening. Specifically, I think they had asked about the Devereaux Resilience Survey. Although Devereaux does have some things in Spanish, it does not look like they have a Spanish translation of that document. And it certainly is something that could be done and should be done. It would just require an expert to be able to do the translation, but not available in Spanish right now.
Okay, and to follow up with that, could you also address whether there would be any additional trauma caused to the traumatized student as an unintended consequence by making the child feel like everyone knows about embarrassing details in their life if they're, approached or if the Handle with Care program is in their school?
So I think that, and I think our other speakers can probably speak to the confidentiality part, but it's critical that when these reports are made that confidentiality is strictly maintained, just like our medical records. These things have to be completely confidential. So no one outside of the teachers and the administrators would know about the incident. So unless the child themselves shared the experience with their classmates, I don't think that there's a great danger for others to become aware of it. But maybe my other panelists could address that better.
Sure. Sarah or Chris, anything on the confidentiality restrictions?
I would like to add, yes, I think it's that re-traumatizing the child is critical. And as Sarah mentioned, the ongoing training component on how educators will deal with these notices and how to address a child who may be acting out. But 100% that needs to be avoided at all costs, because that perception that everyone knows for some very sensitive emotional issue that may have had to happen to the child the night before. That's why we strongly urge that silently monitoring. We're not encouraging the educator to directly approach the child when they arrive at school first thing in the morning. See how they're behaving throughout the day and monitor that, and then address them, maybe address them during lunchtime or pull them aside to talk privately. But that's a very important component to it, and with additional training and awareness, I think everyone will do a much better job with that. But just to reiterate that, there is nothing else on that form that gives away any specifics or details. There is code with, and maybe Sarah could speak to the juvenile code. I know that there is under 2A4A60E, which does allow law enforcement to speak to principals about specifics, but that's not the purpose of this program. And I don't know if you wanted to speak in any more detail about that, Sarah.
Yeah, agreed. Agreed, Chris. I think the point of this program is, again, like you said, not to re-traumatize. The point is for that silent monitoring. The child in this case is not an actor. The child is a victim. The child is a witness. So with respect to the juvenile statute, we're not really in that realm. We're more we're more with, you know, in the world of children who are simply victims and victims who have witnessed something traumatic.
All right, thanks. And Sarah and Chris, we got some procedural questions perhaps we can address. First, does the parent have to give consent to law enforcement for this? And also, how is Handle with Care interacting with virtual and hybrid learning? And finally, how will a school know how to access the forms? We had a question from a school nurse who said, how will I know if my district is participating so I can access the forms? So I don't know which one of you want to take that, if you want to start with about the consent of parents for law enforcement to share the info.
This is Sarah. Hi.
Go ahead, Sarah.
So I was just going to start briefly with consent. So with consent, and Special Agent Yakam, you could probably expand on this. I don't believe there needs to be consent for requesting the school. I think it's common practice with some of the officers who respond to these traumatic events or incidents in general when children are present. I believe that's true. Is that correct, Special Agent?
As far as the Handle with Care program, there is no parental consensual needed. So law enforcement officers are encouraged to file and submit the form to the schools by the next morning. If the parents ask or if they engage and say, I don't want that passed, then the officer would honor that. But otherwise, they're not requesting consent from the parents. Regarding the virtual,
right,
that is a great question. I'm sorry, I stepped on someone.
No, go ahead. I was going to say we could move on to the virtual and hybrid learning.
Okay.
Go ahead, Chris. Thanks.
Great. Yeah, so the virtual learning is obviously creating obstacles for this program. It's very difficult, as we often discuss, and those who have young children knowing what it's like, and teachers who are experiencing that and trying to teach children virtually, that we do have that disconnect, and that's something we're aggressively working on. The communication piece is critical. The educational piece is critical as far as trauma and letting teachers and schools know about that. But it is challenging, but we're doing our best. If law enforcement, they are still sending the notices to the schools, even in the virtual learning status.
All right, thanks. And then just the final part of that, is there a way that someone in the school, whether it be the school nurse or a teacher, know that they can access the Handle with Care forms?
So the way it's structured is that we really want to leave it to the law enforcement, whether it be the chief in that jurisdiction and the school itself, to work out the specifics on who would receive that notice. We don't want to dictate it from a state level, and if there's a good relationship that currently exists, or a principal or the superintendent wants to handle that, how and who receives those notices, we would like to keep it at that discretion so that we're not dictating every process of the program. Schools are very different. They're different as far as resources that they have available. So really, we leave it to that discretion, where if a principal wants to delegate it to a school counselor or a school social worker or the school nurse on who receives those notices, we'll leave it to their discretion.
All right,
that's correct.
you.
So with the directive, we specifically left it open like that because we do acknowledge that every county, every law enforcement agency, and every school, public, private, all in between, everyone is different. Every group is different. Their resources are different. Their access to certain databases are different. So it's going to depend on each agency to work with the schools and the school boards and the private school associations to determine how best to handle it within their district.
All right, thank you, Sarah. Dr. Fletcher, I'm wondering if you could speak on how maybe pediatricians and primary care providers are being or should be updated and trained on this issue, and also ways that they can assist to help kids with resilience and coping skills, and also substance use prevention strategies.
Yes, so the American Academy of Pediatrics, which is a large organization, national organization with more than 60,000 members, gives really great annual educational programs, and ACEs are included in that. And that's actually how I found out about ACEs, by attending a meeting 5 years ago in D.C. I also make an effort to go out and do grand rounds to different pediatric audiences, and I also speak to OBs, and I speak to adult medicine specialists because they're seeing the downstream effects from ACEs. So that is how I think we're getting the word out. Maybe we're not doing it as well as we could. There's a wonderful TED Talk about adverse child experiences that is made by the current health secretary in the state of California. Her name is Nadine Burke-Harris, and they're doing very active ACE screening in the offices. The other question, I think, was about the resources for children who've been traumatized. And I think this is where we need to really rely on our psychologists, psychiatrists, and mental health professionals to be available and to get involved when a child has had these kinds of experiences. And as we all know, mental health services are severely undersourced and underserved, and especially in our communities here, where we most need those services. But those are the people that we need to bring into the fold when a child has experienced trauma.
Thank you, Doctor. And also, could you speak to supports that may be available for New Jersey school children who have experienced long-term trauma due to the incarceration of a parent? Is that something
I actually don't
I'm not sure
have
if that
a very good handle on that, but maybe our other panelists do. I'm not sure that I can answer that very well.
Sure, thanks. Does the Handle with Care program extend to anything that is kind of a pre-existing situation? Is that something that either of you are aware of that you can speak to, or is it something maybe we can refer the person who asked that to another source?
Angela, just for clarity, a pre-existing, would law enforcement send a notice to the school?
Yeah, so the question was specifically if a student has experienced trauma due to the incarceration of a parent for a long period of time, is that something that would be impacted or be part of Handle with Care?
It's unlikely because law enforcement wouldn't really respond to the scene of a particular incident. So it's unlikely that a notice would get sent with regarding that particular situation.
All right, thanks. And I think this next question could be for the entire panel. Perhaps Dr. Pletcher, we can start with you. How long is it recommended that the schools silently monitor the student?
Oh, I'm really not sure if we can give it a time frame because it's probably such an individual situation. But once the school is notified and they're doing their very kind of quiet monitoring of the child, they can see if the child is experiencing problems over time. And clearly, a child may not have some of the consequences immediately, and there may be some longer-term issues with their school performance and behaviors in school. So I think it's up to each school and possibly their counselors at school to keep an eye on the child for an extended period of time, depending upon just the circumstances. But it's very individual.
Okay, great. Thank you. We had a question about if someone wants to work with or volunteer with this program, are there any opportunities for that?
I would think absolutely. I think.
Okay.
Oh, sorry. I would say absolutely. I think that the agency or organization or group should reach out to their local law enforcement agency or county prosecutor's office and offer their help and assistance. The law enforcement agencies and counties will be speaking, like I had mentioned, with the schools to kind of develop all the intricacies and procedures to put in place to make this program most effective. And I think that if a group or organization is looking to assist in any way, that would be very helpful.
All right. Chris, anything you would like to add to that?
The only thing I would add is as well as with the schools. So the schools, maybe it's just having, parents or respected adults around that children are comfortable with, where they don't see, law enforcement as an authority figure, or, some teachers as maybe in positions of authority that they wouldn't be comfortable with. But, again, it all depends on what the school has available and those types of resources and the privacy. So there is room, and there's an opportunity to volunteer in this area, both on the law enforcement and on the educator side.
All right, great. Thank you. And I guess we just have one, we'll take one last question. I know there are some questions that we haven't been able to address. We're coming to the end of our time. So this is a question just for the overall panel. We talked today about a solution to a very significant issue. What other types of prevention strategies or other communication would you recommend, or do you think would be beneficial to really share the word about this tool and how people can spread the word? Dr. Fletcher, do you want to start, and then we'll go to Chris
yes,
and Sarah?
so there is a bit of controversy about whether all patients coming in for care should complete an ACEs survey for their physician. And in some places, such as California, it's become a part of all encounters. But certainly as pediatricians, we need to be very aware of this and to be screening patients and be on the lookout at all times for some of these exposures, because if we find it early, we may be able to address it. So I think, but all physicians, in adults, children, everybody needs to be aware of the availability of these screening tools and to identify at-risk patients so that we can provide a little better care, a little more individualized health care for those individuals, as well as psychological support and potentially mental health services.
All right, thank you. Chris, can you go next, and can you touch on when this, there's been a lot of questions and clarification between you and Sarah, if you could touch on when this all goes into effect and when it is available, and also some trainings after you respond to the question. Thank you.
Sure. I'll let Sarah address the point as far as when it goes into effect based on the Attorney General's directive. I think to follow up on the question also that you asked Dr. Fletcher on how we get this awareness and education out. And I think there's a big push. There's a lot within the different foundations throughout the state of New Jersey that are working on trauma, resiliency, and ACEs. So I think the awareness piece, we're definitely getting traction in that area. Peer-to-peer support and testimonials by peers and adults who have experienced trauma and have came out the other end based on trusted adults and getting resources at a young age that help them deal with that social, emotional, physical, that trauma that they've experienced in their lives. So we're trying to build off the video that we initiated with the Handle with Care, and have testimonials of people who really understand how trauma impacted them, adults, and have them give testimonials and explain the value of it. And I think as we continue to educate law enforcement and educators in this space, that it'll continue to grow and have impact in our youth.
Great, thank you. I think you answered that perfectly. And Sarah, if you could just touch also in answering that question on whether when this will be available statewide.
Of course. So the effective date of the directive, the 2020-9 Handle with Care directive, is the end of this year, December 31st. So that's when the directive goes into effect. In the meantime, we are requiring that law enforcement officers virtually attend that November 17th symposium. Those who can attend will have to virtually view the symposium before the end of the year when the directive takes effect on December 31st. So in the meantime, we're hoping that these trainings and possibly town halls could happen to kind of spread the word on ACEs and the Handle with Care program so that we get cooperation and communication between all of the parties.
All right, great. And I know, speaking on behalf of the Partnership for Drugs in New Jersey, we will do all that we can do to help spread the word about this great resource as well. I want to thank all of our panelists for being here with us today. I think your comments were all very well received and really explained the program. There's clearly a lot of interest in Handle with Care and this tool, and so I thank you for being with us today. All of our attendees, you'll see a survey pop up on your screen now. If you could please take that and give us some feedback on today's learning activity, I would appreciate that. I want to thank you all for joining us today to learn about this very important issue. As I mentioned earlier, information on today's webinar, including slides and a recording, will be available on knockoutopioidabuse.drugfreenj.org, as well as information on upcoming training that will be taking place in November for pharmacists and understanding the opioid crisis and what pharmacists are doing to help address it and how COVID-19 plays a role in that. Again, thank you for all joining us today. Thank you for committing to be part of the solution to address New Jersey's opioid crisis. On behalf of Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Office of the Attorney General, NJ Cares, and the Partnership for Drugs in New Jersey, we wish you continued good health. Have a good afternoon, everyone, and be well.